Nonkululeko, welcome back to the show. Thank you so much for joining us.
Hi, Shayla, and good evening to the listeners. It's really good to be back.
Lovely. Now, ever since we have had this discussion, run me through what has taken place.
Hmm. For some reason, it feels like it happened so long ago, but it
Yeah.
was literally just 2 weeks ago. So, as you correctly mentioned, we have now joined a handful of countries across the globe with some sort of prevalence number or indicator that speaks to the experience of obstetric violence in the country's healthcare system. So we launched the report officially in the middle of March. So yes, it was on the 11th of March. So, taking kind of a hint from human rights day and really grounding it in what it means, when we say that reproductive health rights are human rights as well.
And Guli, I know that we have had a conversation before, but for those who are catching on to this conversation, let's just start by giving off a definition to obstetric violence.
Mm. All right, so obstetric violence is a particular kind of gender-based violence that manifests in hospitals, in clinics, and healthcare settings, and it affects women and girls, should I say, who are pregnant, who are either giving birth or in the postpartum period. And it looks like a number of different things. It can take on a more physical form. So that is, physical assault, slapping, pinching, hitting, dragging across the floor, forcibly restraining a woman to the bed. But it can also manifest itself in, kind of verbal abuse, where women are insulted and essentially stripped of their dignity. And then it can also manifest itself, psychologically as well, but also systemically and structurally. So if we look at how, health departments, for example, are funded, and maternal health in countries, for example, is funded. That is an example of a systemic kind of violence that, reproduces a lot of these conditions that we find in our healthcare system.
Nguli, you keep on saying, and I suppose this is in my headspace, right? It does feel like this conversation took place a while back, but I do know that there is some good news. There is a glimmer of hope. We are seeing government, responding positively to this. They have acknowledged that obstetric violence is a form of GBV. Talk to me about the conversation there.
Hmm. That is a very important conversation. So previously, we had kind of thought about obstetric violence not as a systemic issue, but had thought about it in terms of kind of individual instances, and we had no real sense of the scale of the issue. And I think that's also why it's been so easy for obstetric violence to continue unchallenged, just because it wasn't officially recognized by the Department of Health or any other government agency as a particular harm against women and girls. So now that we have that, it is incredibly encouraging. And yeah, we're hoping that this really does mark a turning point in terms of the kind of right-based care that we're wanting to see in our clinics and hospitals.
Let's talk about some of the research behind the memorandum. I know that the Embrace Birthing Survey has been described as groundbreaking. Let's talk about what makes this report such a turning point for the conversation.
Well, I mean, for a number of reasons. The first one I think I've alluded to a couple of times, which is that previously we didn't have sort of a number to attach to the issue. We just knew from sort of anecdotal evidence and from women who have been talking about it. And, I always say, if you walk around your neighborhood and you ask women about their birthing experiences, obviously providing a very safe space to have that conversation, you'll find that obstetric violence is very, very kind of rife and pervasive. But previously, it was a lot easier to kind of, put it down to a few kind of bad apples in the system, as opposed to acknowledging that there's a systemic issue that we do need to address. So that definitely is, the first very important thing in terms of getting that recognition of obstetric violence. But I think another thing that was quite critical with this study was the inclusion of women's voices, in the actual study. So if you have a look at it, and it is available for download on our website, we've included the voices and the experiences of women as well. We didn't just kind of minimize it to a stat or to a bunch of stats, but we gave voice to women who very often have not been able to talk about what they've experienced.
I want to look at findings beyond the delivery room. I do think because this is a systematic issue, it's a systemic issue. It's ingrained in the culture, if you will, that there has to be that some kind of reflection of what happens post delivery and how this is continuously becoming a repetitive cycle within the frame of society. Do your findings also echo that as well?
Mm. Yes, they definitely do. And I think that's been one of the things that has been, incredibly encouraging. Obviously very difficult to kind of, grapple with and sit with, but, it's shown, or the research has shown that, delivery is obviously, something that happens in a finite period in time, but the effects of obstetric violence are very kind of far reaching and stay with women, 30 years, 20 years, 10 years after the experience has happened. And just speaking to some of what's come out of the research is, for example, maternal mental health and obstetric violence's impact on, women's psyche and women's mental health is quite a big one. And if you think about, then this is a woman whom we are, as a society, are expecting to, immediately jump into, this motherhood nurturing role and to provide care, when her own kind of mental health has not been seen to and has been compromised in that very kind of transformative moment of becoming a parent. Depression, anxiety, women reporting high rates of that, trauma as well. But I think what's also quite interesting is how obstetric violence kind of informed women's reproductive choices as well. We talk about the Maputo Protocol and, in our constitution, every woman and girl having, the right to decide when she wants to have children, how many children she wants to have, and how far apart those children need to be. And that's really the crux of, this idea of reproductive justice. Women essentially being stripped of, their ability to make those decisions because they're so traumatized by, their birthing experience that they vow never to have other kids again. And then we've also seen, in terms of the healthcare system and how it impacts women's ability to be health seekers. So a lot of women reporting that they, either cannot go back to the same facility where it happened. And again, if you think about how South Africa's healthcare system is, structured, and your point of entry into the healthcare system would probably be a local clinic or your local hospital, but feeling they can't go there anymore. Or just not feeling comfortable and not feeling like they have a sense of trust in the healthcare system, which is very worrying if you think about childbirth being, a time when you need to be able to rely on and trust on your medical team.
Nkuli, you speak about mothers being sort of expected to come into the state of absolute care and affection for their children. I also think about the reality that they need to return back to society and act as though life is just peachy. You've given birth, great, good for you, happy days for you and your family, and now you expect to go back into the classroom if it is, the working space if it is, and so all of that, I can't imagine the gravity of I suppose just the weight of this expectation on this woman who's just gone through so much in the delivery room that she can't echo and express, and perhaps finds it difficult to share because it's not a lived experience for most. And even if it is that case, you sort of see that we hold information toward ourselves. So there's quite a bit to tackle there when it comes to the mental health. In actual fact, a can of worms that I don't think we should be opening right now. Let's talk about the department's response. I want to look at whether you think this response is genuine. Is it real? Is it something that we can look forward to as a society, as a nation? We are still in conversation with Nonkululeko Mbuli, who is an advocacy and communications strategist at Embrace, the movement for mothers. And we are looking at the way forward toward eliminating obstetric violence in the spaces of healthcare in South Africa and hopefully beyond. Nkuli, I did say to you that I wanted us to sort of look at government's response and essentially how the public is supposed to receive this. Is this a glimmer of hope? Is this the solution? What's the frame?
I'm going to put it right there in the middle and say it is definitely a glimmer of hope. So is it, a whole solution yet? Absolutely not. But it is a very encouraging and very kind of historic moment. It's a very encouraging start. So like you said, just the recognition, the acknowledgement that obstetric violence, is a thing that exists in our healthcare system. That was definitely really big. But in addition to that, there've been about 5 other really strong commitments that the department has made, and that we are quite hopeful about, and look forward to partnering with the department where possible to realize some of this.
And with those particular commitments, do we have structures for accountability?
It always comes down to that, right? Implementation and accountability. And that's why I was like, I'm going to put it right in the middle and not say we're not at, full solution stage, but there is hope. So just to quickly run through some of what came out of the discussions on the 11th was, a commitment to a stated commitment to institutionalizing respectful maternity care. So you'll remember during our last conversation, I spoke about the national guidelines for maternal and peripartum care, and how for the very first time in 2024, a new chapter was added on respectful maternity care, as kind of a way to prevent and address obstetric violence. But what was particularly concerning for us, even as this brilliant document was developed, was that there was no plan for implementation that we are aware of. And another thing that was concerning at the time was that implementation looked like, it was obviously left up to province and to facility level to decide how to implement, and that obviously makes implementation and accountability, a lot more difficult. But I think taken all in all, altogether, the commitments do show a very sincere, very genuine kind of commitment to change. So it's the recognition. It's also a commitment to respectful maternity care training, which was one of our demands. And we've been advised that by the 30th, which is next week, I believe, online training will be available for health workers on respectful maternity care on the Knowledge Hub. So we'll definitely be keeping an eye on that as well. And there was also a commitment to look into making that training mandatory as opposed to, just for professional development points. In terms of other commitments that have been made, public education campaigns around obstetric violence, and particularly around women and girls understanding their rights when accessing reproductive health care. So all of these really do show a strong commitment to working together to eradicate this, because there are no winners in a healthcare system that is broken and failing women.
I think as a parting shot, Nguli, I'd love for you to address the public because the healthcare system is made up of people. And essentially, if we want to see change outside the government's efforts, we need to change the way we think. There's that mindset shift that's required. And so, to he, she, they listening, what would you say?
I would start off by saying that healthcare is a right. So it is not a privilege. It is not a commodity. It is a very basic, fundamental human right. And I think if you approach, a system, any system, including the healthcare system, with the knowledge that you are a rights holder, and that you deserve and are entitled to a particular level and standard of healthcare, then that can definitely give you the boldness to be able to, assert yourself and claim your rights. But I would also say, we do have some material on our website that people can download, especially if you are an expecting mom or you know an expecting mom. We do have some information that could assist with, just helping you to understand what to look forward to and what some of your basic or fundamental rights are. And then I would also say, please don't stop sharing your stories. The reason we are at this stage is because there has been an outpouring of women, sharing their stories and essentially affirming what the department has said, which is that obstetric violence is real. So, let's continue to hold our leaders accountable, and let's follow up on on the various commitments that have been made.
Absolutely. And we are counting on you to keep us abreast with the latest. Nguli, thank you so much for joining us this evening. It's been a pleasure.
Thank you, Shayla. Always a pleasure.